Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment.
Right? We hate cold calls. A lot of people do because of just the rejection we face. We're scared to speak to strangers, the past experiences. But let me tell you guys this, if I waste 1,000 phone calls, if I call 1,000 people, a lot of people are going to say, well, Michael, that's a waste. If I convert maybe 100 of those people for appointments. People are going to say, well, Mike, you just wasted 900 calls. You just wasted maybe 5 minutes per call, 5 times 900. That's a lot of minutes. Well, look, guys, if those 100 people that I set up appointments increases my chance of converting them, that's a pretty good deal. Even if I called 1,000 people and maybe I got 50 appointments, that is still a great deal. You have to be able to look at the little wins, and that's why, honestly guys, and I'm so glad that you guys attended this course that we're offering, because we're giving you guys that free cold calling training that you're going to be getting later on, that you can watch in full and entirety and really pay close attention to. That's going to be able to increase your cold calling success. The reason why people fail is because people just are not prepared. The reason why people fail is because they don't have a script. The reason why people fail is just they don't know how to handle phone calls, and that's why we want to be able to give you guys the full training. Now, in the next thing that we're going to do right now, we're going to talk about the wrong way of calling. This is typically the wrong way on how most people make those initial phone calls. Remember, when we make these calls, the purpose is actually not to get a referral. A lot of the times we just want to start selling people right away, selling our services, selling our products, and that is the wrong thing because you are rarely going to get a referral on that first call. You are rarely going to get an appointment or a referral on that first initial presentation and visit with these referral sources. This is a relationship building type of industry, and we need to be able to create relationships to be able to get them to know us, like us, and then ultimately trust us to be able to have us take care of their patients or their loved ones. So this really is how I really hear a lot of marketers go at it, right? When they make that initial phone call, they'll say, hi, can I speak to the social worker? And then somebody says to them, who is this? And then all of a sudden, they start selling themselves. They start saying, hi, this is Janice with ABC Home Health. We're a local home health agency in your area. We offer skilled nursing, physical therapy, occupational therapy, speech therapy, and we have amazing staff with us, and we have quality care, and we want to be able to take care of your patients. I was hoping if you can try us out, please. Right? And that is the wrong thing. Or you may go in front of the decision maker and then you start pushing your services. Remember, when you make that phone call, more likely you are talking to the gatekeeper. And that gatekeeper don't really care much about your services because they need to answer the next phone call that's coming in. And if you think you can sell yourself and your services to these gatekeepers, and all of a sudden these gatekeepers are going to go and sell your services to the social worker or whoever's in charge of referring patients to home health agencies or home care companies, you are completely wrong. And so this is where we need to learn and understand that if we are in a prospecting phase, we are not in this selling phase. And the truth is this, you should never sell or push your services. It shouldn't be that way. You should have to be able to do it the great way, the smooth way, and that's what we're going to train you later on. Right now, once again, it's a cold call. So never ever, first of all, say who you are, who your company is, what do you guys do, what you're offering, and then ask for a patient. You have not given any value yet. And value, to be able to create the relationship, does not happen until you start meeting with them and you have the presentation, you start creating rapport with them. All right? So it is wrong because you're trying to sell right away. And do not sell to the gatekeeper because the gatekeeper do not care at all. Now, why really should we make these phone calls? Think about this for a second, right? Like I said, number one, it increases the chance of being able to close and get those referrals rather than walking in cold. The next thing is it allows you to get those small wins, to get juicy information, okay? The name of the gatekeeper, the name of the decision maker, the name of other people that you need to be able to speak to, the time that maybe the decision maker is going to be in the office, because sometimes they're never in the office, all right? Now, ultimately, your main goal is to get an appointment to be able to meet up with them and present your services to them directly. But if you're not able to get the appointment, to gain more information, name of the gatekeeper. Why? So when I call the next time again and I say, hey, let's say it's Tim who answers the phone call. Like, hey Tim, it's Michael. I called the other day, tried to speak to Janice, your social worker. Is she in right now?
Brought to you by our partners at homecareansweringservice.com and medicationreminderprogram.com. So medicationreminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, homecareansweringservice.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have homecareansweringservice.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time, at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.